Welcome back. Always a pleasure to have you join us here for Global News Morning. It is time to check in with one of our favorite psychologists, Dr. Kris Boksman. She's here today to continue to help with recommendations to assist with our stress and mental health. Dr. Kris is a clinical psychologist who works at the Limestone Clinic here in Kingston, and we're here to talk about a new treatment for emotional dysregulation. It is something called Brainspotting. How are you, Dr. Kris?
Hi, Bill. Thanks. I'm doing well, keeping very busy right now.
Well, I know that you've been talking about brain spotting for a while. It's something like talk therapy. There's a lot of different talk therapies out there. What is new and exciting about brain spotting?
Brainspotting is new-ish. It's been around for around 15 years or so now, but its power and treatment ability is really starting to become better known in our communities, in our therapeutic communities. So this is a type of talk therapy that is based on the premise that where you look affects how you feel. It was discovered a while back by a New York-based therapist named Dr. David Grant, who's been working to help refine the techniques. And what's really exciting about brain spotting is that it offers new ways to approach problems that have been previously not very treatable.
So give us an example of where you might look could affect how you think and feel.
Okay, so I could go on and on and on about brain spotting. I'll do my best to be as brief as I can because it gets me super excited. It's the most effective that I've ever been as a therapist to date using this particular modality. The idea behind where you look affects how you feel is that our eyes are actually very directly linked to our emotional regulation and processing centers in our brain. And there seems to be a way by which when we are looking in a relevant eye position somewhere in the room or beyond, and we need to work on a specific emotional activation that's distressing us or causing us harm, the eye position can facilitate getting the trauma or the emotional dysregulation kind of out of our systems and better processed. And there seems to be a greater speed and efficiency at which we can do that relative to traditional talk therapy, where we're spending a lot of time up here in our thinking and reasoning centers of our brain that do not connect as directly to the emotional regulation centers of the brain. So that's the general idea.
It almost sounds like with help, the brain can help heal itself.
That is what makes me the most excited about this. And you're bang on, Bill. Thank you for saying that. With brain spotting, we seem to access the brain's innate ability to heal itself, which we didn't previously recognize was possible. So it's a super exciting way to help people and to receive treatment as well. It's not as difficult anymore.
You cite that there's speedier results than, I guess, some kinds of talk therapy, and also results often offer physical and emotional symptom relief.
Yes. So lots of people refer to brain spotting as therapy on warp speed. Not everybody can do brain spotting in a super speedy fashion. It is a little bit different from what we're used to in traditional talk therapy. However, most people receive much faster symptom relief. So it's not unusual for people to say that they feel markedly better after one session of brain spotting, whereas with traditional therapies like cognitive behavioral therapy, it can take 6 to 8 weeks or longer before you really notice much of a result. Also, in terms of the physical and systemic changes that may be noticed, I've been very happy to witness changes in people who no longer have chronic nausea or upset stomach, chronic headaches, chronic muscle fatigue. A lot of that stuff does resolve with traditional talk-based psychotherapies as well. But again, with brain spotting, there seems to be an extra layer where when we pay attention to our physical activation, we can settle it through this technique too. Not everything is curable with brain spotting. It's not a snake oil or a panacea, but it does seem to offer some inroads to previously intractable problems, which is very, very exciting.
It sounds like you're very excited about this kind of therapy. It sounds like you've also had proven success with it as well. For more information about brain therapy, you can always contact Dr. Kris Boksman at limestone.clinic for more information. You have a great summer. Be well.
Thanks, Phil. Great to see you.
Thank you. You too.